You started treatment, you are showing up, you are doing everything you are supposed to do, and you are still in pain. So you grab your phone, maybe it's late, maybe you just got up from the couch and your leg is burning again, and you Google, how long does it take a chiropractor to heal sciatica? I know you did, because my patients tell me this all the time, and I get it. You are not looking for a medical journal. You just want someone to be straight with you. You want to know if this is actually going to get better, and when. Sometimes that question comes out in my office as frustration. Sometimes it comes out quietly, like the person is almost embarrassed to ask. And sometimes it comes from exhaustion, because sciatica is really hard to explain to people who have never felt it. It is not just the pain, it is the not knowing. So let me just answer it, straight up, the way I would tell a patient. I am Dr. Megan Tomberlin at Waves of Wellness Chiropractic in Leland, North Carolina. And today I am walking you through exactly what I tell my patients in week 1, week 4, and week 12 of sciatica care. The real timeline, what to expect, and what it means when things are not going the way you hoped. Before we get into it, if this kind of honest, practical health content is helpful to you, go ahead and hit subscribe. We put out videos like this regularly for our community here in the Leland and Wilmington area, and for anyone dealing with these kinds of issues no matter where you are. So let us start with what sciatica actually is, because a lot of people come in having been told they have it without fully understanding what is happening in their body. The sciatic nerve is the longest nerve in your body. It starts in your lower back, runs through your glutes, and travels all the way down each leg. When something compresses or irritates that nerve, whether it is a herniated disc, a tight muscle like the piriformis, or inflammation in the lumbar spine, you can feel it anywhere along that entire pathway. That is why sciatica can show up as low back pain, hip pain, a burning sensation down the leg, numbness in the foot, or even that sharp electric shock feeling that stops you in your tracks. Here is something important to understand before we talk timelines. Sciatica is a symptom, not a diagnosis on its own. What is actually causing your sciatica matters enormously when it comes to how long recovery takes. That is something we figure out together in your very first visit. Okay, week 1. This is where most people are when they first come to see me, and honestly, this is often the hardest part. The pain can be intense. Sleeping is rough, sitting is uncomfortable. Getting up from a chair feels like a whole production, and you are probably doing exactly what we talked about at the beginning, searching for answers late at night because you just want to know when this ends. Here is what I tell every patient in week 1. Your job right now is not to feel completely better. Your job is to calm the nervous system down and start reducing the inflammation. We are not trying to win the race in the first lap. In that first visit, I do a full assessment of your spine, your posture, how you move, and where the nerve irritation is actually coming from. From there, we build a care plan specific to you. In those early sessions, we are working to restore proper movement in the joints of the lumbar spine, take the mechanical pressure off the nerve, and help your body come out of that guarded, locked-up mode it has been stuck in. Most patients feel some relief after their first few visits. Not complete relief, but a noticeable shift. That matters more than people realize because sciatica can be demoralizing. Even a 10 or 20% improvement in those first days tells us we are heading in the right direction. I also spend time in that first week talking about what you should and should not be doing at home. Movement matters. Staying completely still is usually not your friend with sciatica, but neither is pushing through pain. We find that middle ground together. Week 4 is usually where things start to turn a corner. By this point, we have had several sessions, and I have a much clearer picture of how your body is responding. For a lot of patients, this is when daily life starts to feel different in a real way. The sharp flare-ups happen less often, you are sleeping better, you can sit through a meal or a car ride without dreading it. This is also when I start introducing more active rehabilitation into your care. Early on, the work is more passive, meaning we are doing the work to your spine and nervous system. By week 4, your body is ready to start building its own stability back. We bring in specific movements and exercises designed to reinforce the progress we are making in the treatment room. Now, I want to be honest with you here because not everyone is at the same place by week 4. Some patients are feeling dramatically better, others are making solid progress, but it is slower. Factors like how long you had the problem before coming in, your age, your activity level, whether there is disc involvement, all of those things affect your pace. Slower progress does not mean you are failing, it just means we adjust. Week 12. This is the longer game, and it is the one most people do not plan for. Full resolution, meaning you are back to living your life without constantly managing symptoms, typically takes anywhere from 6 weeks on the shorter end to 3 or 4 months for more complex or chronic cases. Some people with significant disc herniation take a bit longer than that. By week 12, my goal for patients is that they have moved out of active recovery and into what I call maintenance and prevention. The symptoms are largely resolved or well managed. You understand your body better than you did 3 months ago. You know your triggers, you know how to move, you have tools to use if something flares up. This is also where I talk to patients about not disappearing the moment they feel good. I completely understand the impulse. Life gets busy, you feel better, you move on. But sciatica has a way of coming back when the underlying mechanics are not addressed long term. Staying consistent with the exercises we have built together and checking in periodically goes a long way toward breaking that cycle of flare up, recover. Now, one more thing I want to address, because not everything that feels like sciatica behaves like typical sciatica. If your symptoms are not improving at all after several weeks of consistent care, if numbness or weakness is getting worse rather than better, or if you have any changes in bladder or bowel function, those are signs we need to look more carefully at what is happening and potentially coordinate with other providers. I always make sure my patients are getting the right care for what is actually going on, even when that means a referral. The main thing I want you to take away from all of this is that sciatica is very treatable. Most people do get better, but it takes a realistic timeline, a clear plan, and a provider who is actually paying attention to you and adjusting as you go. At Waves of Wellness Chiropractic, that is exactly what we do. My partner, Dr. Jordan, and I work closely with every patient to make sure you understand what is happening in your body and what we are doing about it. We are not a high-volume clinic where you feel like a number. We are a small practice that genuinely cares about the people we serve here in Leland and the surrounding communities. If you are dealing with sciatica right now, or you have been putting it off because you just did not know where to start, come in and let us take a look. Your first appointment is a real conversation. We listen, we assess, and we give you a clear, honest picture of what is going on and what your options are. You can call us at 910-859-8359. We are at 473 Old Waterford Way, Suite 118 in Leland, North Carolina, and you can visit us online at wavesofwellnesschiro.com to learn more or call to book your first appointment.